Welcome back. 9:13 is the time on this Tuesday morning. A new investigation finds about a third of U.S. hospitals have violated a federal law designed to offer you some basic rights in the emergency department. It's called the Emergency Medical Treatment and Labor Act, or EMTALA. The Fox Medical Team's Beth Galvin joins us now to talk about it. Good morning, Beth. And what does this law actually say?
And good morning, Sharon. So this law was enacted when Ronald Reagan was still president, and basically it was designed to keep hospitals from transferring patients who couldn't pay to other hospitals. This was a real problem in the 1980s, but a Georgia Health News WebMD special investigation found that patients today aren't getting the care that this law is supposed to guarantee.
If you end up in the emergency department, the Emergency Medical Treatment and Labor Act, or EMTALA, guarantees you the right to be screened and stabilized, even if you don't have health insurance and cannot pay. But Georgia Health News' CEO and editor Andy Miller teamed up with WebMD on an 8-month investigation that found hundreds of U.S. hospitals violate this 30-year-old law each year.
We found it in hospitals of all sizes, but particularly the smaller hospitals had a higher percentage. We also found that there was a higher percentage in the Southeast versus other areas of the country.
Miller says the most common violations involve failures to medically screen patients and transfer them. 1 in 7 involved patients having a psychiatric emergency. 1 in 12, a woman who was pregnant or in labor.
We saw examples of them being told, look, we don't do baby deliveries, go somewhere else. And the problem with that is every hospital, every emergency room has to have the capability of delivering a baby. That's an emergency. It's considered an emergency, a woman in labor.
The report found Georgia had the 6th highest rate of EMTALA violations, and smaller hospitals were more likely to have them, largely, Miller says, because of a lack of resources.
And what that might mean is they don't have adequate nursing staff. They may not have a physician come in on call. In many cases, patients had to wait hours to get screened for whatever medical condition they had.
The Georgia Hospital Association declined an on-camera interview, but released a statement saying Georgia hospitals examine all patients who come into their emergency departments, regardless of citizenship, legal status, or ability to pay. In a medical emergency, the GHA continues the hospital will do everything it can to stabilize the patient. If the hospital does not have the capability or capacity to stabilize the patients, arrangements are made for the patient's safe transfer to a facility that does. So what are your rights in the ER?
You have a right to be screened, medically screened, to determine what your condition is.
If the hospital is unable to treat you, Miller says, it needs to timely transfer you to a hospital that can. It's the law.
But one big challenge is that EMTALA is a mandate, but it is not funded. So hospitals are left with the unpaid bills. And the American College of Emergency Physicians says some health insurance plans will deny coverage for emergencies that turn out to not actually be emergencies. So say a patient comes in with chest pain, but it turns out not to be a heart attack. That might not be covered. And ACEP says the coverage should be based on how a patient presents in the emergency room initially, not on the final diagnosis, because then it's all kind of harboring on, is it a real emergency or is it not? It's confusing and
it really
expensive.
is confusing and big concern too. So what are the fines if a doctor or a hospital is found in violation of this law?
So they're pretty hefty. The violations are not common. They're about 430 maybe a year on average, but the fine is $50,000 for a hospital, $50,000 for a practitioner.
And if you feel that a hospital is violating the law,
you
what can you do?
complain. You can complain to the Centers for Medicare and Medicaid Services. We have a link on our website, fox5atlanta.com, on how to do that.
Very valuable information.
Thank you, Sharon.
Beth, thank you.